Hi guys! Guess what? We are finally going to get into the bilateral stimulation. I finally completed my research and we are going to touch bases with two different sites. And the first one is going to be through Emotional Therapy Calgary, done by a registered psychologist, Rod Mitchell. And the second one is going to be through Trauma Therapist Institute Training for Psychotherapies. And I'm also going to add in some of my own stuff that has been done and how that works through my own therapy and personal experience. We will also get into the safety of how this process all takes place next. So, safety first. We're going to go through this before we even start. Important considerations for bilateral stimulation. Bilateral stimulation can bring up intense emotions or memories. This is why it is typically done under professional guidance. Especially in order to avoid the dangers of EMDR therapy, some of these risks and side effects are 1. Strong emotional reactions during or after practice. 2. Resurfacing of repressed memories. And 3. Feelings of discomfort and distress. These responses are normal but can be challenging to manage on your own. Bilateral stimulation is a powerful tool if you're dealing with severe trauma or complex mental health issues. Always seek professional help before trying it on your own. Next, it says when to seek professional help. You should consult a mental health professional if you have a history of trauma or PTSD, you're experiencing severe anxiety or depression, you feel overwhelmed by emotions during or after practice, you're unsure about how to properly perform the techniques. Next is safe self-practice guidelines. If you've been cleared by a professional to practice bilateral stimulation on your own, here are some tips. Start slowly. Begin with short sessions, 1 to 2 minutes, and gradually increase duration. Number 2, choose a comfortable method. Whether it's visual, auditory, or tactile, pick what feels right for you. 3, practice in a safe environment. Find a quiet, peaceful space where you won't be disturbed. I prefer my room. 4, be aware of your reactions. If you feel overwhelmed, stop and take a break. 5, keep a journal. Record your experiences to track progress and identify any concerns. Now, my personal experience with this, EMDR didn't start out right away. First, my therapist felt she needed a history, how I was, my mental health issues, what triggers me, what don't, things like that. Then we moved on to emotions and what triggered my emotions and what didn't. And so she kept track of all that stuff. And we started out with the regular EMDR, which is visual. Now keep in mind there are 3 methods. There's visual, then there's touch methods, and then auditory. And I'm going to explain those 3 methods real quick here. Visual, usually it's a light bar and your eye movements go back and forth, and I will show you a demonstration of that. Now next we're going to go through the touch method. Now keep in mind some alternative states of your mind may not like to be touched, or not all of them maybe want to be touched. Depending on how your history is, how you are with touch, it may not be something that will work for you. Hence the reason why there are so many different methods of bilateral stimulation being created to stimulate the right and left hemisphere. Okay. Now, touch methods include shoulder tapping, hand tapping, butterfly hug, knees, or vibration hand tools. And the knees and vibration hand tools, I can't give you a demonstration because that's done in therapy for me. But what that is there's these little hand tools that you hold that vibrate the left hemisphere and then go to the right, just like it would with a visual stimuli. And sometimes when you are in a childlike state, it's something that can be tucked under your knees or put in your hands depending on how coordinated you are. For me, at times I'm not very coordinated if I am in a childlike stance or fight to flight freeze response. Hence, my therapist will take the little tools, tuck them under my knees, and that will give a vibration stimuli of the left to right hemisphere, bringing that anxiety down. Okay, now keep in mind this is my own personal experience. It may be different for different people. Another method that is mentioned, as you've seen, is the butterfly, and this is this. And you can focus or go as slow as you like. I prefer slower because my brain is not as active. And last is the knee tapping. Now keep in mind, if you're okay with touch, your therapist can also do this, but you tap back and forth from the left to right knee while you're trying to talk. And this keeps the brain very busy. The idea is to slow you down, to help you process emotions, memories, all that. Now last is auditory, which is by sounds, okay? With sounds, you usually use headphones, and music, rhythmic sounds, a choice of emotional stimuli of your own can even be used, a specific sound that can be 8D'd. Now, you can go online to 8D your own music, and it can be used in therapy to stimulate the left and right hemisphere, okay? I have personally done this with an MP4 player, where I bring it home occasionally and change the music on it to stimulate an emotion that I need to have. Now keep in mind, this is my own personal experience. I'm just sharing it with you because it could be something useful for you, and if it's not, it's not. But it is very helpful, especially even like smaller alternative states of the mind. So per se, you age regress and you get stuck in a childlike state, okay? A lot of times, if you can't do the visual kind of EMDR or stimuli, as I'd stated, the hand tools can be used. And if per se, let's say a little doesn't like that feeling, they don't want to be touched, they don't want to be anywhere near. My therapist finds that slipping the headphones onto my ears while I'm in that freeze response at an age regress state, she finds that it can bring the level of the nervousness or the upsetness of that age regressed alter into a better state of mind. Music is chosen that is workable with that age and type. That is why it is so vital to have a therapist that is trained in dissociative disorders, because if you have a regular therapist that isn't trained with dissociative disorders, EMDR can be very harmful. So be careful of that. Please do your research and find what works and doesn't work for you. So here is a demonstration of me using the headphones. Now let's get into a little more of the complicated stuff of bilateral stimulation. For one, the benefits: stress reduction, anxiety relief, trauma processing, easy to learn, and emotional release. Now, let's explain what bilateral stimulation is. If you are new to this, you probably won't understand it. Bilateral stimulation is a powerful technique used in mental health therapy. It involves rhythmic side-to-side movements or alternations that engage both hemispheres of the brain. Okay? This method can be visual, auditory, and tactile, which is touch. And it's used to help process traumatic memories and reduce stress. I do apologize if I mispronunciate things and my words don't sound correctly at times. I am dealing with severe jaw issues with the fibromyalgia, where it's not really like a locked jaw, but my brain says one thing and my mouth comes out and says another. So here are those three things that I just said, and you're more than welcome to look at the chart here. And just below that, down here, it says how bilateral stimulation works in EMDR. During EMDR therapy, bilateral stimulation is used while the client focuses on a traumatic memory. This combination helps the brain process the memory more effectively. Here's what typically happens. 1. Memory activation. The client recalls a traumatic event. 2. Bilateral stimulation. The therapist applies one of the bilateral stimulation techniques, which are those three things that I mentioned. And 3. Processing. The client's brain processes the memory, often leading to new insights or perspectives. And 4, integration. The memory becomes less distressing and integrates into the client's lifestyle. Now, personally for me, and this is my personal experience, number 4 is a touch and go, because keep in mind for DID it's a little bit different. So integration could mean multiple things for somebody with dissociative identity disorder. From my personal experience, usually it means that when let's use a little as an example, a small alternative state of my mind feels that she's processed that memory enough to give it to me. So basically her memories of the event will be less traumatic for her, and it is basically, my therapist will say, can you give it to Eva? And that can be 4 or 5 times. It takes a while for me to accept a new memory, and I have to do the same thing. I have to process it the same way. And once that's over with, the relief I feel is like heaven, which I've talked about before. I feel less scared, more grounded, and I sleep better and more relieved. So it gives you an idea of how well this actually works. So next, let's get into the changes. What does it do? Well, it basically changes, and you can see here, observable changes during EMDR sessions. Clients often experience noticeable shifts during the bilateral stimulation process in EMDR therapy. It states emotional changes, moving from distress to calmness, physical sensations, tingling or warmth in the body, and last is cognitive shifts, gaining new perspectives on traumatic memories. Now, my personal experience, keep in mind that EMDR can be hard for some people that have what I have, so there has to be changes, and it has to be changed to your needs depending on how EMDR affects you. And so that's why we're going to get into this part down below here, bilateral stimulation in other therapy methods. Okay, therapists are also finding success in combining bilateral stimulation with other therapeutic techniques, which is why we're talking about this. Number 1 is mindfulness. Pairing bilateral stimulation with mindful exercises can enhance emotional regulation and reduce anxiety. 2, cognitive behavioral therapy, known as CBT. Using bilateral stimulation during CBT sessions may help patients reframe negative thoughts more effectively. And this is a good one for me. I love cognitive behavioral therapy when it is mixed in with the bilateral stimulation. And it seems to be very effective for my alternative states of my mind as well. And 3, neurofeedback. Combining a real-time brain, activity feedback with bilateral stimulation can improve emotional control and anxiety management. And it says on the bottom, bilateral stimulation isn't just for EMDR. It's not. It's really not. They actually use it, which I wish I could get into more detail, for dementia patients, schizophrenia, you name it. It seems to really help a lot of different mental health issues. It's being used to enhance various therapy approaches, both in person and online, offering new hope for those struggling with anxiety and depression. Now, while you're looking at this chart here and looking at this chart here, I'm going to read this piece here. The brain science behind bilateral stimulation. Bilateral stimulation engages both hemispheres of the brain, fostering communication between the different regions. This process is thought to mirror the natural information processing that occurs during REM sleep, a crucial phase for memory consolidation and emotional regulation. Okay, research using near-infrared spectroscopy found that bilateral stimulation significantly increases activation in the right superior temporal sulcus, a region closely linked to memory representation. Now it states here, brain region interactions. During bilateral stimulation, 2 key brain areas come into play. Number 1 is the oblongata, responsible for processing emotions. And when you have DID, it is very hard to regulate your emotions. Hence, your alternative states sometimes are your emotions. They take on anger, sadness, depression, things like that. 2 is the prefrontal cortex. involved in logical thinking and decision making. Okay? By stimulating both sides of the brain, bilateral techniques help these regions work together more effectively. Okay? This improved communication can lead to better emotional regulation and stress reduction. Okay? Bilateral stimulation acts as a bridge between emotions, the amygdala, and the logic of prefrontal cortex in the brain, helping you to process difficult experiences more effectively. How bilateral stimulation impacts information processing. Bilateral stimulation is believed to have these benefits. Number 1, enhance neural connectivity. Number 2, facilitate the integration of cognitive and emotional elements. Working that all out. Positive. Number 3, unlock the brain's natural ability to process and integrate information. And 4, aiding in the reprocessing of traumatic memories. While more research is needed to fully understand the mechanisms at work, many people report feeling more relaxed and clear-headed after engaging in bilateral stimulation techniques. And that is very true. I have found that there are times my husband has to drive me and I'm disoriented and dissociative and not myself. And on the way home, I'm like, "You want me to drive?" He's like, "You sure?" I'm like, "Yeah, I feel good. Let's go." So it does work. Now, last, the funnest part of all this, which is something I was amazed and happy to talk about. Did you know that Power Wash Simulator, the game that you can do through a Steam account, is actually useful in stimulating your positive amygdala? So, there is an article which is shown here. It's called Gaming for Mental Health. New study links playing Power Wash Simulator to mood improve. And you're welcome to look this up. It's the same with the other articles that I had talked about in my previous videos here. That's in the beginning. I show what the articles look like and where you can find them. Okay. So, out of that article, study author Matty Vorier and his colleagues sought to better understand how playing video games in a neutral context might predict players' moods. Okay. They analyze a large longitudinal database containing data on players' psychological experiences while playing Power Wash Simulator. Power Wash Simulator is a video game in which players run a small power washing business, taking on jobs from a variety of clients in different locations presented as levels. The core mechanic involves aiming and using a pressure washer to clean dirt from various objects, ranging from Ferris wheels to skate parks. The game is commercially available on Steam, and I play it personally. I've played it for 2 years. Okay. I also asked permission of my therapist if it was beneficial, and she said it was. So a lot of people with ADHD, autism, anxiety disorders, insomnia, the back and forth movement of the washer and the up and down movement of the washer brings that level of anxiety down, causes a positive feeling. Okay. The researchers were particularly interested in investigating whether players' moods change when they start playing, how much these changes occur, whether this happens to all players is just some, and how these mood changes develop over the course of the game session. And you're welcome to read the whole article. I'm not. I need to keep a video down to a certain amount of time, so please go check it out. There are also various other articles. I also participated in filling out one of the forms of how it helped my mental health. Very grounding, love the game. I've even ordered the extend packets at times because it feels good to play it. There's no challenges, there's no you can die, it's just a positive game, and I love cleaning, so it works out. We found strong evidence for a positive change in mood over the course of the play sessions. Our findings invite further research into the mechanisms governing who experiences the larger impacts of gameplay on mood, which likely includes both psychological factors and in-game behavior. Study authors concluded. Pretty cool, huh? So, that is all I have today. Thank you for everybody asking me to do research and talk about bilateral stimulation. There's so much more behind it. I welcome you to go read more into it, talk to your mental health care therapist about it, find out if it could be beneficial to you or not. Keep in mind there are some negatives depending on how it's used. So one method may not work and another may. So something cool to check out. So that's all I have today. Loves. Bye.